Welcome. My name is Dr. Fuji from Kashiba Asahigaoka Hospital, Nara, Japan. Today I will present to you some surgical tips for TKA and femoral posterior release that we can get the ideal extension gap. No matter what device you use, you may have experienced the extension gap being tighter than the flexion gap despite your best efforts in many situations of TKA. In general, textbooks suggest that it could be accomplished by releasing the posterior capsule. However, do not provide detail and it may be difficult to fully understand from just reading the book. I will introduce a safe and efficient way for the posterior release in this video. Please pay attention to how to treat the attachment of the ligaments and capsule, and how to detach them and how deep I can go. The point we focus on today, posterior release. I believe this process is needed especially when you perform the TKA surgery with a modified gap technique. The extension gap may change a little bit smaller than you expect when you insert a femoral component. Although you're convinced to create an extension gap equivalent to the flexion gap, posterior release is necessary to create enough space of the extension gap. This is an issue that only occurs with posterior stabilized type TKA component. Generally, no bone structure should exist on this area. Having calm structure, it's no wonder why it makes a compression towards the soft tissue. Let's take a look at how I do the procedure safely on my surgical video and model bones. The assistant pulls the tie up by foot retractors on the condyles. You can see the intercondylar area that we want to release now. Easy to see if you give it some tension when pulling it off by the tweezer. Touch the tip of monopolar on the intercondylar bone structure. You make sure the part which having the tension by the tweezer. Like it, you can peel the posterior joint capsule off the bone. Again, please keep in mind, touch the tip of the monopolar on the bone. You can check the release by your finger. Bending the tip of monopolar is more reliable when touching the tip against the bone. That's it. We will go to the slides and look at these model bones that have been generated from that surgery. First of all, on the left picture, you can see like this during the surgery. There are edges on the intercondylar area after doing the box cut, and mainly the residual ligament fragments are still staying on it. Then, in the middle, this would be how posterior of intercondylar looks like that you can't actually see during the surgery. There is no soft tissue anymore, so as you can see, the shape of the bone looks clearer now. I released this part from the bone in the middle picture. Comes of the femoral component is coming right here. Move to the right picture. Once you finish up the release, you cannot actually see that, but allows you to feel by your fingers like this. The most important thing is you need to do the whole process with the patient knee stabilized by deep flexed position. Processing by extended position would be associated with much higher risk of damaging their tibial nerve. Here is the actual data we've collected. It is obvious that the extension gap goes wider after the posterior release. In fact, this data indicates that extension gap increases average 1.6 mm after posterior release. This data is all from Echon debut, which has a smaller cam over some of the other posterior stabilized TKA systems. You will expect bigger differences from the other designs TKA products. How was it? So far we have introduced our technique about the posterior release. I'm going to review all the tips briefly here. To expand only the extension gap, I believe the most reasonable way is posterior release. The assistants can elevate the femur, and I will pull down the posterior capsule and the residual ligament. You will release the soft tissue on femoral posterior by using monopolar. The key is doing the whole process by a flexed position. I hope that this video will be useful to your surgery. That pretty much sums up today. Thank you so much for your time watching this video from Kashiba Asahigaoka Hospital, Nara, Japan. I'll see you next time. Bye.